Welcome to the Pure Perspective Podcast, a podcast for families who want to go beyond symptom-based conversations and understand how the nervous system influences sleep, behavior, development, and long-term health. We're here to break things down in a way that is clear, practical, and encouraging, so you can support your child from the inside out.
Hey guys, it's the docs at Pure Chiropractic. We are on the sixth episode of the Pure Perspective Podcast. We are happy that you joined us. We are starting to get the hang of this, I would believe, maybe a little bit. Today we are talking about constipation. So we've got lots of kiddos that come into the practice with that concern, and mom and dad don't often believe that we're even the first line of defense to help with that. And so they tell us that it's happening. And then when we share that we can help with it, they are usually pretty amazed and excited to see the results. So that's what we're going to be chatting about today.
Yeah, so I did another video that we have posted on the platforms earlier this week talking about this. And one of the things that I think a lot of parents don't realize is that Miralax, which is commonly prescribed for constipation, it doesn't even have FDA approval. So until you're 17 years old, it is considered an off-label treatment for constipation. Yeah. And I think what we always talk about is what that does to the neurology, how hard it is for the body to overcome something that's definitely not natural to it. And then that just continues to tax the neurology and make the body work harder and harder. And so that's where we come in, is ultimately, if you can establish good brain-body communication, then you can regulate digestion naturally. It doesn't have to be a medicated solution.
Yeah, I mean, if babies and kids are getting prescribed with Miralax, it's like they're just trying to cover up that symptom and help them deal with what they're dealing with. I know it's like frustrating for parents, especially just because they don't want to see their kids uncomfortable or like struggling to go to the bathroom. But that's a natural, like you said, like it's an unnatural way to make something natural happen. And so that's why we're here to reach deeper into what is actually going on rather than covering up some of those symptoms to then manifest into something further as like anxiety, aggression, ADHD, anything like that. Just puts them more in a state of fight or flight.
Which I think parents expect certain symptoms tied to their child dealing with constipation. They expect the soreness in the stomach. They expect the straining. But I think they don't expect the stuff that we worry about, where we see anxiety and we see depressive episodes. And you see some of these nasty mental health category items tied to the usage of this particular constipation medication. So it's definitely a concern for us.
I think we've had a number of patients that the parents are at their wits' end and they don't have anything else to do. And I would argue I would say all of our parents that come in, none of them are eager to use Miralax. None of them are like, yep, I did it. And they're not like worried about it or upset about it or concerned that their child has to take it. And so it's not like I think that they're at a place where they're not feeding into that as like, oh, this is the norm. My child's just going to have to live on Miralax for the rest of their life. I think they know that that's not effective and that's not the way that they should have to go through daily life. So they know that when they come in and they're like, yeah, we had to give them Miralax, they're not excited about having to have done that. And so I think that puts us one step ahead of like, okay, well, if you don't like doing that and you don't want to see those repercussions happen where we see increase in anxiety or paranoia or OCD or just behavioral outbursts, when we get to the root cause and we instill in that child how their digestion is supposed to work the way it was created to, well, now they don't have to use it, hopefully ever, but less frequent for sure if that is something that their child is struggling with still. And I think the biggest thing that we maybe don't consider all the time is that I don't have kids, so I don't know. This might be a you thing. Diets are hard with kids. You need them to be fed and happy and getting nutrients, but sometimes that comes from things that are not going to give them the best digestive properties, right? And so that's a hard conversation we have to have with a lot of our parents where we're like, hey, what does their diet look like? And they're like, he's 3, he doesn't want to eat veggies. And I'm like, okay, yep, exactly. So trying to battle that is definitely difficult for parents, but
there's also that deeper piece, right? Like a lot of kids that are begging for the things that we know we shouldn't give them, that's their own neurology.
Yeah.
Begging for the fast fuel, the junk fuel, because it already is showing that sign of exhaustion, right? And ultimately Miralax, like all it's really doing is dehydrating other areas of the body to pull fluid into the intestines to soften the stool.
Yeah.
That doesn't feel like a real solution to a problem, because I would ask any parent who's doing that, okay, so then if their body creates the constipation symptom and that's the treatment, is that what you're prepared to do all the time for the rest of their life? And if that's the answer, then fine, so be it. That's
We're
your
not
choice.
yeah, we're
But
not your
we're
help.
not going to be the solution for you, or part of the solution. But that, as a parent, I can't imagine that being the way I would want to handle things with my kids.
Yeah.
Yeah.
I think at the point where I mean, we've got babies that come into us into our office that are, like, having blowouts on the table because they get adjusted and they clear out their nervous system interference, and when we adjust, upper cervical areas or we adjust sacrum or lumbar regions that give that good communication to those areas that are supposed to either instill the rest and recover response that allows the body to go into that digestive track, right? That digestive property or function. But the other side of it is like there could also be dysfunction at that lower thoracic, upper lumbar region that isn't allowing the body to even digest foods properly or absorb the nutrients the way it's intended. So they're not going to the bathroom the way that they should. And so there's a multitude of different ways that that child could be suffering from constipation, but it ultimately is their body is in fight or flight. And so I think if we talk about regardless of the region that that interference is at, once we look at the scans, we can most often see that they are stuck in sympathetic dominance or they have parasympathetic deficiency, right? And so for those of you that have listened, that parasympathetic response is that rest and recover response where that fight or flight is the sympathetic response. And if that child can't get into a parasympathetic state of mind, if their body's running on fumes and go, 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 and it feels like it's in fight or flight, your body's not worried about digesting your food if it thinks you need to be in fear of your life,
Mhm.
Mhm.
right? And that's a very I wouldn't say difficult, but it's hard for parents initially to believe that their 2 or 3-year-old is in fight or flight, right?
Yeah.
Like, they're like, "Oh, what do you mean? They don't have to worry about anything. They don't pay bills. They get to sleep in a nice cozy bed. They get snuggles whenever they want. Like, they're eating, they're doing all these things. They get to play." But that nervous system is wound up and overwhelmed and stressed out, and if they're not seeing the good functions of the body, we're going to see that that body is not working as well as it should, and that's just instilling even further into that fight or flight response. It's so
Well, and those two things are tied together because you were talking about the food part of it. And so we would tell those parents the reason they get into the stressful state in the first place is the three T's. It's the thoughts, the traumas, and
yeah,
the toxins. And we know that thoughts is probably the main driver for most people. But the reality is the toxins, especially in the world today, especially with kids. Like we get a lot of parents in that they're like, oh, my kid likes Kraft macaroni and cheese. Well, unfortunately, I'm here to tell you that the version that I had as a kid looks nothing like
Oh,
the
it's so
version that the
different
kids
now.
have today.
yeah,
And so it may not have felt toxic to you then. You may not think there's any repercussions in your neurology as a parent because of it, but your kids are not living the same life with the
yeah,
same toxins.
yeah,
So we have to take that into consideration that you may feel like this kid is perfect and they're wonderful, but they're living in a bath of toxins all the time. And so that's going to create that stress response that ultimately dampens that nervous system's balance. And then all of a sudden the symptom
yeah,
starts to present. And I think what something Ann and I were talking about this week, we were going over a few assessments. And it's really tricky because a lot of chiropractors and a lot of doctors in general, they want this to be a equals B conversation. And so we look at these assessments and we might talk to parents about regional complaints or about patterns of the neurology. And parents want this to be adjust that solves this. And it doesn't work like that. And I
yeah,
think that's a tough one that we were both frustrated by because it's like, how do you change that messaging that there is a process in play that is whole body. It's not just if we adjust that segment. And that's why it's usually more work than parents anticipate.
It also goes back to the neurosoft signs. So eating, sleeping, and pooping, especially with newborns and infants, it's that they should be in the parasympathetic or be able to have the balance and be able to activate the parasympathetics. And so if they are stuck in that sympathetic fight or flight and their body thinks that they are in some threatening situation to where those systems are not resting and recovering and functioning like they should. And so if those three things, eating, sleeping, and pooping, are not happening, so if they are constipated all the time, then obviously they're just going to get more into that fight or flight and not be able to like bringing in the toxins. Like they can't detox, they can't get that out of their body, so it's just stuck in there and just creating more of a mess, I feel like.
But ultimately, like you just said toxic too. Like we talked about the food side of it, but that's what your digestive system is doing. It's detoxing the body. It's using everything to drain into the
excreting
stomach
every
to kill everything with acid to then push it through the system and get it out of the body.
yeah,
So if that system plugs up, we got a
You
big
just got a
problem on our
lot of
hands. We got a
toxins in your
lot of,
body.
well,
Yeah.
and they'll just kind of work their way back into the body. And so
Yeah.
that's incredibly dangerous at a young age to have that sort of challenge. So
And I will say, I think the part that we've talked about in previous episodes is the behavioral component that comes with it. And I'm sure as adults, we know if we're not feeling well or we've eaten like garbage over the holidays and we're backed up or we're not feeling as good as we should, we're not having a great time either. We're maybe a little bit more stressed or bloated or cranky or lethargic or just feeling like brain fog all the
Mhm.
time. That's our bodies triggering to us, hey, you've got a lot of toxins in you. We need to get these out. We need to, go to the bathroom. And if kids are doing the same thing, if those kids are coming into us for those behavioral concerns, we need to remind parents, like you said, of those neurosoft signs. They want those behavioral concerns to change immediately. If they're constipated, until that gets
Yeah.
regulated, those things aren't changing. And so when it comes to those neurosoft signs, if those are not happening, nothing else will go away. Nothing
Mhm.
else will change for that child. And so we'll often say, like, how are they eating, sleeping, and pooping in every single visit with it? Because we want to make sure that we are seeing those changes. Otherwise, us trying to help your child's behavioral outbursts or their, dietary restrictions, neither one of those things are going to get where we need to go if they aren't doing those first three things well and
Yeah.
effectively.
And like they say, the stomach is the second brain. And so, like what you said, if your stomach hurts or if you are constipated or anything like that, it definitely just ruins your mood, energy, all of it. And the vagus nerve is a big one, I think, with everything that we do. It's a really big component of that parasympathetic side of the nervous system. And so, vagus nerve travels from the brain to the stomach. And I think like 2/3 of it is in the stomach or something. And so, if that vagus nerve can't calm down and create a sense of that rest and recover, then it really throws everything with behavior out of all kinds of
Yeah.
sorts.
well, and like there's always like, I mean, I guess it's, I don't want to say common knowledge, but it feels more common now that we know that autism is one of those diagnoses that is under that nervous system umbrella, right? And yet parents don't recognize the correlation of the percentage of kids that have an autism diagnosis that also have a constipation diagnosis. And so you're basically dealing with a nervous system that we know is taxed. Now we have another symptom that we give Miralax or we give other medications that are literally showing to cause more problems in the body, in the nervous system. So how do you ever recover a child with autism's nervous system to some version of balance if we're going to treat symptoms that are just creating more irritation into the whole system as a whole? It's a bad cycle.
And since we've spent so much time speaking about pediatrics, I think it's a good spot because most kids are not listening to this. The parents are listening to this. If you're a parent suffering from that or just an adult in general, we've had, I can think of two patients right now. One, she just gave birth last month. No, beginning of this month. And she said that like digestive issues were a big struggle for her all throughout like her adolescent into adult life. And she expected pregnancy to wreck her digestion. And with consistent care through her whole pregnancy, she never saw any of those issues.
Yeah, I think it was after the first
And
couple
then,
weeks.
yes,
Yeah.
exactly. She's like, I'm never going to stop this. This is the best thing ever. And then we have another patient who she has been under care with us for about a year now. And she has been off of any sort of help when it comes to constipation. So, Miralax or other laxatives or stool softener, she hasn't had to use any of those because she's been getting adjusted regularly. Where before she was like, oh, it was like 5 years of consistent use.
Mhm.
So, if you are an adult and you want to get that checked out, we would love to help you as well. And
Absolutely.
your
Well, and
kids.
it's simple. The testing that some doctors will put you through to try and
GI
just,
mapping,
yeah, it's like
this and
there's
that.
some really crazy stuff.
Yeah.
Yeah.
Ours is about
Simple.
6 or 7 minutes
Yeah.
of no poking, no prodding, works for an infant, works for an adult, and it allows us to go and find those areas of stress in the neurology. Because, like I said, it's not A equals B. It's not lost on us the number of times we will find upper cervical irritation and yet gut health problems.
Yeah.
So the body can do a bunch of craziness if we don't
Yeah.
kind of
Yeah.
keep a handle on it.
And let us be clear, last thing, we are not saying that those GI mappings and all those other things are not useful. But at the end of the day, if the nerves controlling that region are not getting good communication to the gut, to the brain, to the digestive tract as a whole, all of the stuff that functional med or parasite cleanses or any of those other things, chelation, those are not going to do their job as effectively as they should. And so we still certainly believe that those things can be beneficial. They just need the right foundation to make those work as well as they should.
But we always talk about sequencing. It's the sequence of events. I literally was just talking to a gentleman yesterday who he was seeing a physical therapist. We think it's time for him to add some physical therapy in. he was hesitant because he said he had done physical therapy before. Well, he's been under care with us for a year and a half now. And I said, your experience now is not going to be what it was then. You're going to be a completely different version in there because your nervous system is actually in a place to be able to handle something additionally added on. And so that's where chiropractic comes in. I absolutely would echo what you said. We are not saying that those other things don't have a place, and they aren't recommendations that we will make for patients as well. But we have to have that foundation first. We have to build off of something stable. So you guys, I think we're going to wrap it up on this one.
Yeah.
I think that's enough poop for one day. But everybody have an amazing rest of the day. We will see you on that next one. Take care.
Bye.